Okay, so let us look at the next important question in this chapter. It is levels of prevention. So first of all, if they ask you this, you can define prevention. It is the intervention in natural history of disease, and you're going to change the course of the disease and the outcome of the disease. The objectives are you're going to promote health, preserve health, restore health, minimize suffering, minimize diseases. What does this depend on? This depends on the knowledge of the disease, the cause of the disease, the transmission, the risk factors, the treatments, etc. Now, the main question they will ask you as levels of prevention. So, for this, you will have to write 4 levels. So, you will have to write the 4 levels. That will be primordial prevention, primary prevention, secondary prevention, and tertiary prevention. What is primordial prevention? Basically, it is a new concept where you're going to prevent the emergence or a development of a disease in countries or population where this disease has not occurred at all. So, this is in areas or countries where this disease hasn't occurred at all. You are going to have some preventive measures to prevent the emergence of such risk factors also, so that this disease never occurs. Okay, so this is a new concept. So you can say this is a new concept in which there is the disease has not occurred yet. Okay, so you're going to prevent the risk factors. Okay, you're going to prevent the risk factors, and you're going to intervene at an individual or mass education level. Okay. The best level of prevention for communicable diseases. Yeah, that's the best level of prevention for communicable disease. Fine. So, we have finished primordial prevention. You'll have to give some examples here. Always give example. Obesity, you can stop the spread of junk foods. Hypertension, lifestyle, you can make sure that they are not having any problem. You can prevent MI, and you can prevent protein energy malnutrition. So, you know protein energy malnutrition is there in a specific place, and you know in a specific place it's not there. So, you make sure that in that place you will give good food to the mother. You make sure that they are knowledgeable about breastfeeding. You make sure that they don't conceive more than 2 children, and you also provide food for the child, and based on its age and growth, you should monitor and provide it food. So, protein energy malnutrition. So, here very specifically you can speak of not more than 2 children, breastfeeding. How you are going to do control protein energy malnutrition? This is the way. Not more than 2 children, breastfeeding, child nutrition. Okay, all this. So, this is primordial prevention. Okay. Now, let us move on to primary prevention. So, primary prevention is prior to onset of disease, right? Disease has occurred in this area and we are trying to protect others from it. So, prior to onset of disease in the individual or in that community. So, the possibility of the disease, you're going to reduce the probability of the disease occurring. Reduce the probability of the disease occurring. Okay. Then, in the pre-pathogenesis phase itself, you will do this. What will you do? You will do health promotion, then new health promotion, then what will you do? Specific protection by immunization, Okay, so all that comes under this. Health promotion, specific protection by immunization. These will be your primary prevention. They can be under that. Okay. Lifestyle change. All this you can include. Risk factors you have to reduce. Basically, you can also get a target audience and make some goals. Now, what will the examples be for primary prevention? Examples will be chronic diseases like coronary heart disease, hypertension comes here again. Cancer, you can do primary prevention, right? So there is a WHO, here you will have to mention something like WHO approaches, recommended approaches. WHO recommended approaches, there are two things under this. Population or a mass strategy. Then you can also have a high risk strategy. So population mass strategy directed at the whole population irrespective of the individual's risk level. Basically, you are going to change their behavior and lifestyle pattern. Small reduction in the average blood pressure, you can see, produces a large reduction in cardiovascular diseases. So lifestyle change, behavioral change, okay, that is population mass strategy. High risk strategy, especially people who are high risk, you will identify them and you will have some approaches to them. Okay. Then what else is there here? Examples are chronic diseases. In that this came. Okay. For chronic diseases, this is the approach. Then you have one more example here. Protein, energy, malnutrition. So looks like hypertension and protein, energy, malnutrition are there in both the primordial and primary prevention. Okay. So look at primary prevention in detail here. The examples are very important. Chronic diseases like hypertension, cancer, WHO recommends population mass strategy and high risk strategy. These are the things you tend to forget, right? Because these are all very generic terms. So you'll have two approaches, population mass strategy and high risk strategy. Under protein, energy, malnutrition, again here you have different preventive measures. You have WHO expert committee recommends health promotion and specific promotion or specific protection, protection. Okay, good. So chronic diseases, population mass strategy, high risk strategy, protein, energy, malnutrition, you have health promotion, specific protection. Finally, for everything you will write a significance. Significance will be primary prevention utilizes knowledge about the pre-pathogenesis phase of the disease, including the agent, host and environment, and hence you can promote health and protect against specific disease agents and hazards. It has wide application because of its low safety cost. This is a low cost, right? Low cost prevention. And what and all you are going to target here? Agent, host, environment. Fine. Let's move on to secondary prevention. We'll see you in the next video.